Warm greetings from the High 10. It is Everyday Shenanigans on this Thursday, April 2nd, 2020. I'd like to bring you some information deriving out of Cookeville, Tennessee. It's not too far from me. It is in between Nashville and Knoxville, Tennessee. What I'm about to tell you is a serious situation because we have been getting different information from medical officials, Washington, D.C., local authorities on how to combat this coronavirus, what to do, what not to do, wear gloves, don't wear gloves, wash your hands, wear a mask, wear the mask properly, stay away from big crowds. And now I'm going to bring you said information pertaining to a nursing facility where a lot of patients and staff members have been affected by this COVID-19. They do have it. They've tested positive, and it's not what you think because most of them didn't have any symptoms. If you need verification for the storyline, please log on to 10 News. 28 patients, 16 staff test positive for COVID-19 at a Cookeville assisted living facility. 90% of those who tested positive were symptom-free. That's what's so scary about this right now. Cookeville and Putnam County leaders announced Thursday that an outbreak of COVID-19 occurred at an assisted living facility, infecting at least 28 patients and 16 staff. The outbreak occurred at Signature Healthcare at Putnam County. According to CEO Lee Rooney, the outbreak happened despite measures put into place starting March 9th to limit outside access to the facility and regularly tested patients and staff. Rooney said, on Tuesday, they requested the local health department to test all patients and staff after learning of one case that had developed. On Wednesday, they got the results. 28 patients and 16 staff had tested positive, and Rooney said 90% of those who were tested appeared to be symptom-free. The center has now mobilized into crisis intervention, creating a special COVID-19 unit internally to separate positive patients and prevent further spread. Rooney said the facility has also called in a team of special infectious disease caretakers to increase staff. It's a trying day, it's a trying time right now, he said. The facility has contacted families. Out of the 28 elderly patients who tested positive, Rooney said none of them were showing fevers over 100 degrees. Amen for that. Saying it was difficult to tell they had tested positive. That's what's scary about this right now. Staff and residents aren't feeling sick, he said. Putnam County Mayor Randy Porter said the spike in cases locally will likely be reflected on the state's daily tracking reports on Friday. The county was reporting 6 cases prior to the announcement. The only way we're going to get past this terrible disease is for you to take this seriously. The next 2 or 3 weeks are going to be critical in fighting this disease, Porter said. That is said information by 10 News. Let me start by saying we have no definite answer when this disease is going to stop. That's first and foremost. Now that we know that these people, 90% of them, tested positive and had no symptoms, staff and patients, this ain't no good. So people are walking around here right now feeling real good about themselves, but they are sick on the inside. And I've told you all that. That has been my fear with the situation. It's the incubation period. How long is the virus inside? What day will we or she or he or they get symptoms? And as you see, they said they took preventive measures March 9th, which is not even 4 weeks, but it didn't matter. Outsiders brought that corona inside because we know that if it's a nursing home, they're not going outside. Most of them aren't going anywhere. They're receiving visitors. So staff brought it in. Workers, people coming in, visitors, family, friends brought that virus inside. People coming in to do the electrical, the wiring, whomever, brought that virus in. And that's going to be the problem for medical staff working in hospitals, clinics, assisted living, nursing homes. You are outside the most. And you are probably be the carrier bringing that virus inside. As so the sick patient coming in the hospital bringing the virus inside. It is a no-win situation. It is a roll of the dice at this point. Now that we know you can walk around a symptom and be positive for coronavirus. It is argued that it is or is not airborne. Most will say, if you really think about it, okay, if it's airborne, then we all would be sick. We all would have COVID-19. Well, we have to ask ourselves this. If you're walking around and got it and don't feel like you got it, then what does it say about it being airborne? Who's to say that it affects each person differently? Do you understand what I'm saying? 90% of these people had no symptoms. And all these elderly people, 28 in total, showed no signs of a high fever. That is interesting. Do you understand what I'm saying? So now we have to ask ourselves, how long has the incubation period been going on? What day did this patient, that patient, get the virus? You'll probably never know. You'll just know the day they say, I don't feel good. That is the scary part about this virus. We don't know much about it. We don't know how it came to be. It has its origins from China, animal to human. But nonetheless, we don't get a hold of ourselves with this virus, some type of medicine, adequate drug, vaccination, cure, we will be back at this situation again, because everyone does not hold business the same way as far as dealing with food, livestock, meat markets, wet markets. You get my drift. We can't tell another country how to conduct business. As most of you who are watching and following me, I just made a video telling you about a city in China that is banning the consumptions of eating cats and dogs, and that will be the start of these viruses passing from animal to human. Because you see, everyone is not around livestock all day, on farms, around rodents, rats, bats, or eating wild animals. And we know that this is the cause of this virus. And most viruses have came from animal to human, some kind of way. And that is going to be our problem in the future. And that is my fear as well, that we will be back at this point again when this virus leaves, subsides, dies down, whichsoever how you want to word it. We will be back at this place again. I'm glad they mentioned the facility that has this virus, so people will be aware, because people do need to know, because their family members are there in the facility, and then there are people who work there, and at this point, that's going to be a problem as well, because who's going to want to go back to work knowing that virus is there? Who wants to take that back to the public, to their home, to their children, to their family? Although we're not supposed to be hanging around people, but it's principle. Why would someone want to go back? And then that's another problem. Getting adequate staff to work with a virus floating around, having enough staff to work. Will they let these workers also return to work? Because as you see in Hawkins County, at that stupid hospital, they didn't mind the people coming back. Well, they didn't mind them not being tested because they didn't have any symptoms. Well, now you see, Hawkins County, this is why your patients and staff need to be tested for corona, because this facility had asymptom staff and patients, and they tested positive for corona. So any fool that tells any of you out there that work in the medical profession or any profession that you don't need to get tested and you've been exposed to corona by a staff member, co-worker, passerby, you tell them, I'm going to get tested. I sure am. And may not come back. It's to my liking or my choosing if I want to come back. And I think that should be up to the person who tests positive for corona. But I do not believe any supervisor, personnel, HR, whatsoever should tell a person they don't need to get a test and they have been exposed to COVID-19. That is the most foolish, ignorant comment to make to a human being, and people are dying every day from this virus. I brought you all this information so you will know what is out here and going on. And like I said, I understand some of you want to zone out. You don't really want to pay attention to social media, the news, but you might want to stay in the know, because you need to know if the virus is in your town, your city. You need to know the stats. You need to know what provisions are being implemented by your city and the precautions. You need to know that. But you also need to know this virus is doing her own thing. She don't care who she touches, and she's hanging around for a while. And it is a matter of rolling the dice to see if you will get it. Because now that we know you can walk around with no symptoms, this is detrimental. And that is the only reason why I brought you this story, is so you will know that several patients and staff members tested positive but had no symptoms. And some people are telling people, such as the cruise ship down in Florida, just send them home if they look all right. Just send them home if they ain't got no symptoms. Well, now you see. You don't know Corona, and you don't know her game plan. And people are walking around with the virus inside of them, and they have no symptoms. So we don't need to be letting anybody jump on any plane, trains, automobiles with other passengers, and they have not been tested. And my other fear is, can you get it again after contracting it the first time? That has not been disclosed to the public, and I haven't heard one medical official talk about that. Can you contract this virus again? And what will happen the next time when this dies down, if it dies down? Will we be back in this same predicament again? And will America be prepared? Because it looks like if we don't get a game plan in store for the next time, we were going to be out of luck. People will be back leaving work, back hungry, back with bills, back calling numbers trying to get unemployment, back worrying themselves sick, headaches, hair falling out, worried, cooped up, folks killing themselves because they can't cope with being inside. And this is a sad day. A very, very sad day for all of us. I'm praying for all of you. Pray for me. I'm praying that there is a vaccination. I'm praying that there's a cure. I am praying that there will be safer practices with livestock and wild meat abroad and in this country as well. I'm praying that people will keep their hygiene up, that people will watch how they live, how they consume food, hygiene, because you see, this is why we have viruses, funguses, all type of things, because we don't take care of ourselves and we don't have savory practices with our hygiene and how we eat, food we consume, where we buy things from. All that matters. And I know some of you may not think that is true, but it always matters. This is why a lot of people stay sick, because you see, they don't take care of themselves. They don't. They don't live well. They don't clean themselves well. They don't keep their homes clean. You have to think about that. And then they go out into the public and they touch the door handles. They touch your desk. They serve you food. They sit next to you, coughing, hacking, sneezing. Get in your car, you get in theirs. Laugh, share a drink. Elbow to elbow. And you're with people who are not well and people who do not have decent hygiene. This is why we have to be careful how we live in this world. That's all I'm saying. Like, share, subscribe, drop your comments below. Thanks for listening. Thanks for joining me. I'm praying for these people in this nursing home, this facility. I'm really afraid right now because this is the thing that's more dangerous is, as I state, people are walking around asymptom, and that is the most critical part of this virus, is walking around and you're sick and you don't know it. And then you take deathly ill after God knows how many days. And that is the scary part, is not knowing the day the symptoms will get worse. Praying for all of you. God bless you. Please keep your hands washed. Share this information to your friends, associates. Lend a helping hand to somebody out there. But also keep your distance. God bless you. Thanks a lot for listening. Bye-bye. Everyday Shenanigans.